All right, so here's a paper I came across last week that will be particularly interesting for people with IBS and other GI symptoms. And we've talked about this before in a on other videos here. I can show you my YouTube channel here. So on the YouTube channel, I've talked about vagus nerve stimulation in the past and using it for things like depression, constipation, SIBO, which is small intestinal bacterial overgrowth. What does the vagus nerve have to do with the gut? And then here's a video showing you, you know, technically how to apply the device and use it. And so that's a video I thought, 7 people ever would watch, and it's actually got over 15,000 views, which is kind of funny. So you never know what people are going to be looking for and liking. But anyway, there's more content on this topic if you want on my YouTube channel, and of course across YouTube as well. So if we get back to the study, this is from 2020 in Clinical Gastroenterology and Hepatology, so the Journal of Gastroenterologists. And basically what they were looking at adolescents, so teenage kids with IBS, and saying, is there how useful would auricular neurostimulation, which is fancy for stimulating the ear with a certain kind of electrical stem unit. It's also called transcutaneous vagal nerve stimulation or vagus nerve stimulation. So there's different names for it. But basically they're saying, okay, we've got teens with IBS. We don't really want to put them on drugs. So can we get benefits with their IBS in terms of the pain and function without giving them drugs? So that was the question of the study. And so the natural thing that they wanted to test and see if it works is auricular neurostimulation or ear stimulation, also called transcutaneous vagus nerve stimulation or percutaneous electrical nerve field stimulation, all kinds of mouthfuls, nerdy words and acronyms that all mean the same thing. And so what the heck does that look like? So before we even get into the paper, let me show you what that looks like. If we go to this.
Hey, Dr. Bartemus here to walk.
There's me without a beard. So that's how old the video is. But I've got Joanna here. And do we have it? So you have a TENS unit here in my hands, and then you've got an ear clip. And basically this ear clip is going to clip onto your left ear right there like that. And so the left ear right here in the left ear is where the vagus nerve can be actually accessed on the surface of the body. It's only on the left ear. You don't want to do it on the right ear. If you do it on the right ear, you could mess with your heart rate and rhythm and things. So don't do it on the right ear. This is left ear only. And so you would take the ear clip and you clip it on that left ear and you run the TENS unit at a certain setting to stimulate the vagus nerve. And the vagus nerve controls parasympathetic function, which is the rest and digest function of the autonomic nervous system, controls that in the GI tract. So here's another video made for you. And so the vagus nerve here controls all the GI. So if we can stimulate the ear, the vagus in the ear, and get it to function better, you can have better digestive enzyme secretion, stomach acid secretion, better motility, moving stool through, so less constipated, anti-inflammatory, all kinds of stuff. Okay, so that's what it looks like to use. So if we go back to the paper, is it effective in teens with IBS? That's what they wanted to study. So what they did, they took how many? They took 50 teens, and they applied the left ear TENS to 27 of them, and they did sham stimulation, or basically placebo, to 23 of them. And they gave it to them for 5 days a week for 4 weeks. And after the 4 weeks, they reassessed. So they did pre and post abdominal pain questionnaires and IBS symptom scores. And basically, after applying it for 5 days a week for 4 weeks, so 30% or more reduction in abdominal pain was seen in 59% of the teenagers that got the left ear stimulation versus only 26% in the placebo group. The patients who got the left ear stimulation had a pain median score of 7.5 compared to 14.5 in the placebo group, so half the pain. So you could say 50%, the pain rating as the placebo group in the second questionnaire, and then 40% better in the third. So basically, depending on how you're asking them, they ask them three different ways in three different validated questionnaires, and in all groups, 30% was the worst outcome. So they got at least 30% improvement, but some up to 50%. And the important thing was there's no significant side effects at all. So why is that important? Well, you've got teenagers with IBS. If you go to the medical doctor and they're going to give medications, every medication has a potential side effect or a list of them. So it doesn't mean it will happen, but it's a risk of it happening. With this, there was no side effects reported, and you'll see this as a common theme because we've covered multiple studies on this, and I've read multiple studies on this, and there's always no side effects, and that's huge because if we can use something natural with no side effects, then the worst possible thing that could happen is it didn't help at all. But the person wasn't subjected to a long list of potential side effects, right? All they lost was, a few minutes with a thing on their ear. So that's great. And the authors concluded left ear TENS reduces abdominal pain scores and improves overall well-being in teenagers with IBS. This is a non-invasive treatment option for pediatric patients with functional bowel disorders. So boom, that's great. But everyone on the call is saying, no, well, awesome, but I'm not a teenager. Well, cool. If you have a teenager with IBS, you can consider this, or these papers have been done on adults too. So if you're an adult with GI issues, this is a potential use for you. Studies have been done on this also for depression and anxiety and other things outside of GI disorders. So again, it's another potential tool in the natural strategy tool belt that can be used for people who don't want medications or people who, medications didn't work for, etc.